So do you struggle with pain and discomfort in this area here? It's not quite your shoulder, but it's not quite your neck. Pain and discomfort through this area here is often an issue with your first or second rib. And yes, your ribs can really go up that high. You might not notice this pain whilst you're sitting at your desk. You might notice it when you sleep at night, you might notice it when you run, you might notice it when you do Pilates. Pain and discomfort in this area that occurs outside of the office can absolutely be caused by something that you're doing inside of the office. At ERGO Collective, we believe that most people's body complaints come from their poor static postures. And where do we do most of those? At work, of course. It's really important to think about the things that you do when you sit at your desk all day. You need to consider the ergonomics, your posture, and your behaviours over the course of a work week, and how issues with these can present with body complaints, especially with first and second rib complaints. So let's have a little bit more of a chat about the anatomy of this area so you can understand how it works and how it becomes problematic for office workers. Okay, let's talk about pain and discomfort in through your first and second rib. Your first and second ribs are up here. Yes, this is ribs. So this is where your first rib is, and this is where your second rib. So it's not at the base of your neck, it's just slightly lateral to that. So in this pocket here, if you do struggle with pain here on the left or pain here on the right, more often than that, it's a rib complaint. Your ribs are designed to help you breathe. That's their job. Your first and second rib, when you sit at your desk all day, their job is basically to help you breathe. They shouldn't have to do anything else other than this, than to sit there passively and gum up and down. Where you run into trouble in terms of office postures and positions is when you end up leaning on an elbow. When you lean on an elbow, all of a sudden you're putting the load of your body weight and it punches out through this area here. So what happens is when you lean on your elbows or you hitch your shoulder, what happens is you engage the muscles that attach to that first and second rib and you put compression through those areas. These areas are not designed to take load. They're supposed to just be passive and help you breathe over the course of the day. But when we start to hitch shoulders or we start to lean on elbows, what tends to happen is you tend to over-recruit the muscles that attach to that first and second rib. And what it ends up doing is it ends up causing pain and dysfunction through these areas. So if you do sit at your desk and you do struggle with pain and discomfort in through this area here, I would encourage you just to check what's going on with your shoulders. Are they nice and passive and are they just hanging quietly by your side? Or are you putting compressive load through them by leaning from your elbows? Or are you hitching them up either to wing or as an unconscious hitch when you work over the course of the day? If you do any of those behaviours, what you'll end up doing is getting rib complaints. And if you can sort that out, then the rib complaint will go away. The first ergonomic consideration in terms of upper rib complaints is making sure that your chair is not too low. The problem is when your chair is too low, your elbow sits lower than the height of the desk. When you're in this situation, what you have to do is you either need to hitch your shoulder or you need to chicken wing your shoulder to get over the lip of the desk to use the keyboard and mouse. So it's really important that when you look at your chair height, you put it up high enough so that your elbow just clears the height of the desk. That way your arm can hang passively by its side and you're not inclined to hitch or chicken wing that arm. The next ergonomic consideration in terms of upper rib complaints is having your mouse too far away from you. It's really important that the mouse sits 5 centimeters in from the edge of your desk. If the mouse is positioned too far away from you, again, what you're doing is you're having to reach or to chicken wing to get to that mouse, which can irritate your upper ribs. The first postural consideration in terms of upper rib complaints are leaning on your elbows. As you can see in this video, as you lean on the elbow, there's a huge amount of compression and load that goes through that upper quadrant of your shoulder. And in that, it will irritate the first and the second rib. It's really important that you understand that your arms are not load-absorbing joints. They're just supposed to hang passively by our side. Anytime we put extended load through our arms, what it does is it compresses your shoulder joint and irritates those upper ribs. The major behavioural consideration in terms of upper rib complaints is hitching your shoulders. You may do it unconsciously over the course of the day. It can be a result of stress and anxiety, but anytime you hitch your shoulders, it loads up your first and second rib. So just check yourself when you're working at your desk. Make sure that you have no tension or tone through your shoulders when you're using the keyboard and mouse. Wiggle your shoulders around and they should just fall passively by your side. Another behavioural consideration in terms of upper rib complaints is when you just turn your neck to look at something. You may have a colleague, you may have documentation, you may have a window that you are constantly turning and looking at. The problem is when you just turn your neck, you over-recruit the musculature in your neck. You can see in this video how much the tone in your neck has increased when you've turned your neck over to the right. The problem is that these muscles connect to your first and second rib. It's really important if you do suffer from upper rib complaints, that if you do have something that you continually look at off to a side, it's really important that you turn your whole body rather than just your neck. The last behavioural consideration that I want to talk about is, again, this winging posture. We've talked about it earlier on in the video in terms of how having your arm away from your body for any extended periods of time is problematic. The thing is, it can be a behavioural thing. Your desk might be at the right height, your keyboard and your mouse might be in the right position, but just as a behavioural quirk, when you use your keyboard or your mouse, you have this predisposition to wing your elbows. So again, just check yourself when you are working and make sure your elbows are hanging passively by your side and that there's no tone through that shoulder joint. As you can see, how you sit at your desk over the course of a work week is really important in maintaining really good musculoskeletal health. Fundamentally, in your body, every joint, ligament, muscle, tendon, bone, it's all got a really specific role, and if you use it how it's designed to be used, generally it'll look after you. What we're hoping is there was something in this video that jumped out at you. Whether it was a behavioural quirk, whether it was a poor posture, whether it was an ergonomic issue. What we're hoping is one of those things jumped out at you, and if that aligns to your body complaint, there's every chance by addressing this and fixing this, your body complaint will settle down. If that wasn't the case and you're still a little bit unsure, what I would suggest is to continually just check yourself over the course of the day. What is my head doing? Where is my elbow? What are my feet doing? If you can continually check in with your body over the course of the day, you'll actually realize that you have a lot of consistency in terms of your postures and behaviors. And if you can identify those quirks and change them, generally you'll find that your body is in a much better position. If you would like a little bit of one-on-one attention, what I would suggest is booking for a clinical assessment with one of our staff. That way we can go through all fractions of your life to try and ascertain the cause of your complaint. Sometimes it's a little bit complicated and sometimes it's not easy and straightforward. And this is where a formal clinical assessment with one of our staff is probably the best idea for you. At the end of the day, how you sit at your desk affects your body both inside of the office, but actually more importantly, what it does outside of the office. At ERGO Collective, we're your partners in office health.